this is Dr. Hazeena, Fetal Medicine Consultant, Motherhood Hospital, Chennai. Today we are going to talk about what is double marker blood test. So along with the NT scan, you have to do one important blood test which is known as first trimester screening, also known as combined screening test, also known as double marker blood test. All have the same meaning only. So in this blood test, what are all the two important factors we are going to see the blood test in? The two important factors are PAPP-A and free serum beta HCG. The normal value is 0.5 to 1.5. If the PAPP-A is like 0.3 or less than 0.4, we call it as low PAPP-A. Why do we see this? Because these two hormones are secreted from the placenta. So in the placenta, if the placenta is not developed properly or if the placenta is having some infection, these two hormones are not secreted properly. So the values will be less. So generally the PAPP value should be more than 0.5, and the same applies to serum free beta HCG. It should be again 0.5 to 1.5. So we have to see the two important placental markers. Along with it, when you just come down, there will be like trisomies. T21, which is Down syndrome, T18, which is Edwards syndrome, T13, which is Patau syndrome. So these three syndromes, three markers we have to look for. If there is trisomy 21, if everything is low risk, nothing to worry. Just you can go along with the target scan and anomaly scan. And if you fall under intermediate risk, you have to go to the next step. Either we have to do NIPT, that is non-invasive prenatal testing, or we have to go for invasive testing. What is NIPT? NIPT is again a normal blood test which is collected from the mother, that is known as non-invasive prenatal testing. So I'll tell you about NIPT in the upcoming videos. So what if it comes high risk? High risk means I told you, like if it is less than like 250, if it is 1 in 200, if it is 1 in 100, 1 in 10, this is high risk. So when you see the report, it is high risk. Definitely there is no space for non-invasive. We have to go for invasive procedure. So now coming to what is invasive and what is non-invasive. All the black color thing you see in the scan will be the fluid where the baby will be floating inside it. So we have to collect a few ml of the sample with a very fine needle. Don't think it is a very big needle. It will be done in the same scan room, which is a very sterile area. Before the patient comes in, we clean the scan room in a very proper way. It should be very sterile. Then we have to start the procedure. It is a very fine needle which is inserted into the mother's abdomen, then go into the uterus, then into the amniotic fluid. We have to make sure the fetus has not been touched. Then we have to collect the fluid in ml and send it to the lab. In the lab, they will culture it and they will send it the other reports. Two reports will come. One is the QF-PCR report. If it is intermediate risk, you have two options. Either you can go for NIPT or for again invasive. NIPT is nothing but blood test collected from the mother. How you gave double marker blood test. In the NIPT, you have both maternal DNA and the fetal DNA both mixed. Okay, so we have to send it to the lab. They will centrifuge it. They will separate it, mothers and fetuses. Again, they will see in the fetus like proper 46 chromosomes are there, because from the mother 23 pairs and from the father 23 pairs, totally 46 pairs of chromosomes should be present in the fetus. So in the 21st chromosome, instead of 2, if there are 3, that is trisomy. If there are 3, that is known as trisomy 21. That is the indicative marker for Down syndrome. And this invasive procedure or amniocentesis is the confirmatory, 100% confirmatory test for all the chromosomal issues. Thank you.